Good morning, everyone. Today, I will be showing you the different parts of a hospital room and the importance of each thing in this hospital that maximizes patient comfort and care throughout their stay. One of the biggest things that we have in the hospital is an oxygen. This oxygen allows us to give it to patients who aren't breathing correctly. And it depends on the patient, depending on how much they're going to need. But on average, we give about 1 to 5 liters of oxygen. And this allows us to crank to show how much oxygen we need to give the patient and depending on how much they need. Something else we have over here, one of the best things we have for nursing, is the call light. This allows the patient to control their bed, the TV, but most importantly, this button right here, the call light. That allows the patient to call the nurse to ask them for whatever they need, whatever it be, use the bathroom, or if they need to talk to their nurse or talk to the doctors, whatever they need to do. Some other things we have in here is obviously gloves, if doctors or nurses need to do something with the patient. Also, we have our sharps box. This allows us to safely get rid of needles and any other kind of sticks that we have to give the patient to protect us from, outside resources. And the most important thing that we have in this room is the IV pump. This allows us to give life-saving medications, antibiotics, any pain medication, any medicine that is in a fluid form will go through an IV in a patient. That is the most important thing that we can possibly have. This allows us to pump, to set the rate, to show how much volume we need to give the patient in order to help them with their medications. Another thing we have over here is the bed. This bed is very intelligent. It's not your average bed. We're able, just from the bottom, to move it up, move just the head up, move the bottom down, move the bottom up. We can even flip it right side up and even upside down if we wanted to. It also allows us to weigh the patient, but the most important thing it does is it allows us to put a precaution on the bed that an alarm will go off and inform the nurses if the patient tries to get up. Because some patients are unsteady and can't walk and they need a little assistance, so we don't want them trying to get up on their own. And that is the importance of a hospital room, and it allows us to give the most optimal care for each and every single one of our patients. The sources I used was Lamone and Burke's 7th edition nursing manual, Luke and Schwartz book instructions, and IV teaching videos by Simple Nursing. Thank you.